Welcome back. August is National Children's Eye Health and Safety Month, and 1 in 4 children, roughly about 12.1 million children worldwide, have some kind of vision impairment. So today we brought in Dr. Jason Reed to join us to talk about children's eye health and health care and safety, and really also not only tips for the kids, but tips for the parents as well, because, you know, kids are going to do what they want, and they're going to kind of just go along, especially at 3, 4, 5 years old. They may not necessarily be able to convey and communicate problems they may be having with their vision. So my first question for you is, when should parents really start to take their children in for eye exams? Well, the pediatricians at birth screen all the babies, and they check them, and if they're at high risk, newborn, if they're premature, they are seen by an ophthalmologist. Especially the cutoff is 4 pounds and 4 ounces. If they're less than that, they need to have their eyes checked because they are at risk for retinopathy or prematurity and some other problems. If they have a family history, maybe they should be seen. You can check kids at any age. But usually the pediatricians do it, and they'll check them 1 year old, and then when they get to be 3 or 4, they're old enough to start to be able to read from the charts. They can either do pictures or they can read letters for us. And so that's usually a good time to have them checked at our office. Okay. And that's, again, a good tip for folks. You know, you don't have to wait for them to be able to see the alphabet and read the charts. I mean, just get them in there early just to try to curb any concerns, early concerns they may have in their life cycle. Right. Now, as far as warning signs are concerned for parents, again, some children, especially at young ages, may not be able to tell you, hey, this is wrong with me. But for parents, what are some of the things that if they notice they need to be, you know, kind of be on the lookout for? Well, sometimes if patients are nearsighted, they will squint, and they may complain of headaches, and they rarely complain of blurred vision. And then often we'll see children that have vision problems in one eye and they have no complaints. And so that's why it's a good idea to have those things checked, because you can develop amblyopia, and what that means is that you have, or lazy eye, what a lot of people call that, but we'll have some people that get it confused with a droopy eyelid. And lazy eye or amblyopia is an eye that functions normally, but it doesn't see well for one reason or the other. And it can be a serious problem, and if you wait too late to correct it, they may not see well at all, because most children's eyes and their brain are developing up until about 8 years of age. And so after that, we're pretty much hardwired. Okay, yeah, and you know, those are important stages of development, not only in your brain development, but also in your vision development as well. You know, so, and other warning signs, you know, I was just, you know, looking at some of the information that you guys sent. You know, if they're standing too close to the TV and they're sitting there, you know, way too close, obviously that may be a little bit of a concern as well for nearsightedness or what far sight. I'm not the doctor, you're the doctor, but those are some of the other concerns along the way as well. Right. And a lot of people confuse that for nearsightedness, because kids do that. Because as you get older, especially after I turn 40, you do not hold things real close because you can't. But kids can see, they can accommodate and focus almost at the tip of their nose. So sometimes that is something to be concerned about, and sometimes it's not. But other things like crossed eyes, I mean, those are usually obvious, and so that would definitely be a reason to come in and have your eyes checked. And that was my next question. If parents see some of these symptoms, what do? They just make a typical appointment and bring them in? Right, definitely. And again, curbing some of the concerns right off the bat is probably one of the most important things. Yes. All right, let's take a quick break, and after that, we'll get into some more of some of the common conditions for kids, and again, what you can do to curb some of those concerns. More with Dr. Reed right after the break. This is Louisiana Living.